is it has like 30 plus mutations on a specific protein called the S protein or the spike protein. Already, Europe is and North America are in the midst of a pretty bad third or fourth wave.
Right.
And I don't think they want to take a chance. I do think people who are not vaccinated need to get vaccinated. I think some protection is better than no protection.
The world is dealing with the COVID-19 pandemic for almost 2 years now. We've seen the first wave, second wave, and a lot has happened since then. A lot of variants have come in, and now another variant of concern, that is the Omicron variant, has come up from the South African nations. So to tell you and make you aware as to what this variant is all about, or what things you need to keep in mind, I have with me Dr. Vivek Anand joining from Fortis, Bangalore. Welcome, Doctor, to India.com and the Health Site.
Thank you for having me. I'm Vivek Padagal. I'm the Director of Pulmonary Medicine at the Fortis Hospital, Banagata Road.
So, Doctor, my first question to you would be as to what exactly this Omicron variant is, what people need to know and be aware of.
So, the problem with COVID from the beginning has been mutations.
Right.
So, these mutations have occurred, and that's given us the Delta variant, the Mu variant,
right.
And all of that. So this latest thing found in the south part of Africa is called the Omicron virus.
Right.
And so what is really worrisome about this is it has like 30 plus mutations on a specific protein called the S protein or the spike protein. Now, why is this important? Because the spike protein is the protein that is targeted by vaccines,
right.
particularly the AstraZeneca, the Pfizer vaccines, all of those vaccines. They specifically target the spike protein. Also, some of the antibody cocktails that are being used as well are also being targeted by this. So, if there is a significant mutation and it looks different, unfortunately, it could lead to these different modes of treatment that can interfere with the treatment and the response to this virus. Okay, so that is what is with this Omicron variant. Now, we don't know much about it except for the mutations are there. We've had previously more infective types of viruses, like the Mu variant, which was in South America.
Right.
And fortunately, it didn't pan out. At one point, it was the predominant virus in South America. And we've not seen a big surge of that. That was the concern. And then we've had things like Delta Plus and
right.
other ones which also haven't panned out.
Right,
Okay,
Doctor. But as you said that we've had a lot of variants of the COVID-19,
right.
SARS-CoV-19. So although, this variant has come in as, a matter of concern even by the WHO, and it has been seen across, more than 10, 12 countries now. And, with this, we're seeing, the international travel has again, come to a standstill. New guidelines have been released. So is it actually really a matter of concern at this stage? Can you point that out?
I don't think anybody knows the answer to that question. I think what is happening is an overabundance of caution.
Right.
Already, Europe is and North America are in the midst of a pretty bad third or fourth wave.
Right.
And I don't think they want to take a chance because they still haven't recovered to what's going on right now, particularly Germany and Austria, a lot of these countries, UK, US, Canada. So all of these places are already in the midst of a bad surge. And going into the winter, they were already worried about it. So if this increases the burden, I think that is why they were so worried about it. But until we know more, I think everybody's going to be a little cautious, and you can't blame them.
Right, Doctor. Another thing that, for whom is it the most, of major concern, for which kind of population? For those who are vaccinated or those who are not vaccinated, of course, it would be, much more dangerous for them. But, will it have any lesser impact to the people who are vaccinated if they come in contact with the virus?
I certainly hope so. I do think people who are not vaccinated need to get vaccinated. I think some protection is better than no protection.
Right.
We don't know how these vaccines are going to interact with this particular viruses. There are some tests going on looking at it in the labs, and that can give me an estimate of what is the protection going to be. Things like AstraZeneca vaccine that we have, the Covishield, also has a long-term effect. It causes the long-term immunity, something called natural killer cells. Now, if these are activated, then this is not dependent particularly on the S protein. And so if that's the case, perhaps some of these other vaccines will give us good protection. But again, we don't know the answer to that. But I would imagine that if you've had the vaccine, and perhaps if you already had the infection, that maybe we'll have better protection. And that is what we're hoping for. So if you're not vaccinated, please get vaccinated. If you haven't had the second dose, please have the second dose, because it's only going to help you.
Right, doctor. So, doctor, another concern is that, what are the symptoms of it? Are they any different from the variants that we've seen in the past, that is the Delta variant or the Delta Plus? So are they similar, or there is a certain differentiation when it comes to the symptoms?
That it is more highly infectious, perhaps. So that means if one person gets it, more people will get spread from it. The Delta itself was pretty infectious, and that's why the second wave was worse than the first wave.
Right.
So, so that could be part of a problem. So again, I don't want to say this over again, but we really don't know at this point. Throughout the whole COVID period, there has been no difference in symptoms. The symptoms are the same: loss of smell, loss of taste, breathlessness, sore throat, body ache, and those sort of things. So I don't think the symptoms are going to change per se, but I think the rapidity of spread and maybe the severity of illness could be different. We do know that it spreads more rapidly, but we don't know how severe the illness is yet.
So, doctor, as we said that, this variant is a major concern. So what precautionary measures specifically, do pregnant women need to follow, because they are under certain medical guidance already? And we've seen that, previously also with other variants, there were certain precautionary measures specifically for pregnant women. So what precautionary measures do pregnant women, they need to take specifically?
Most of the vaccines have been given to pregnant women.
Yes.
And they appear to be safe.
Right.
But you want to have a conversation with your obstetrician to whether you need to take it or not.
Right.
But for most people, it appears to be safe. That is all the vaccines. Pretty much all the vaccines have been given to very large amount of pregnant people.
Right.
So if you can take it, and most of the concerns would be the first trimester. If you pass the first trimester and your second or third trimester, I think have a serious conversation with your doctor and see whether you can take it. Luckily, unlike certain other things like influenza, the coronavirus doesn't appear to cause worsened disease in pregnant ladies.
Right.
And we've had a lot of pregnant ladies get infected, and we've not seen a lot of severe illnesses. Now, like the swine flu had a really bad outcome when it came to pregnant ladies. So in this case, it doesn't seem to be like that. But I think not just pregnant ladies, I think everybody needs to stick to the basics,
Right.
How do you prevent coronavirus? You socially distance, you do hand sanitization, and wear a mask. Right. My favorite quote to tell everybody now is the mask does not know any variant.
Right.
Doesn't matter what variant you have, but the mask is going to work. And we know for a fact that the mask has protected people.
Right.
And I don't understand the reluctance to wear a mask. I think it's a simple thing which really reduces infection rates. So please mask up. It's very, very important.
Right, doctor. And another thing, doctor, do you want to conclude something that, it is very specific about this variant that, that people should be aware about?
Like I said, stick to the basics, If you're not vaccinated, get vaccinated.
Right.
I think we need to seriously start looking at if we need to consider boosters. Okay,
Right.
that is not really yours and my decision, unfortunately. But I think we're going to have to start looking at it as the medical community, especially for healthcare workers and things like that. Again, like I said, stick to the basics: vaccination and masking and social distancing. We're seeing with the holiday season, with the wedding season,
Right.
people throwing caution to the wind.
Exactly.
They're absolutely not doing anything smart. So we need to be smart about this. I mean, we're worried about vaccination, we're worried about this new variant, but we need to be willing to do what it takes to prevent it.
Exactly.
And I think as a society, as a people, we really need to get this message out that, listen, you can prevent this. Okay, just be cautious, and it's an easy prevention. So that's what we need to do for now. I think in the next coming weeks, we will have better guidance of how to deal with this. Maybe we can do a follow-up, and we'll have an idea of what medications work. Does anything else needs to be different? In terms of treatment, in terms of approach, it doesn't look like anything's really going to change, but we're going to have to fine-tune it based on things that develop. That's probably the best answer I can give at this time.
Right, doctor. Absolutely right. I per se agree to it, because as of now we're at a very nascent stage. It's a concern variant, although we're not much aware about it. Although the symptoms of COVID-19 still remain the same, the precautionary measures still remain the same. We need to get ourselves vaccinated if we haven't, and as far as pregnant women or any other person is concerned, they need to take the similar precautions, and we can definitely beat this wave also. So thank you so much, doctor, for joining us and sharing your views and making people aware of this new Omicron variant. Thank you so much for joining India.com and the Health Site.
You're very welcome.
Thank you, doctor.